Alright, we're going to be doing an intradermal medication today. First I'm going to do is I'm going to gather all my supplies, make sure I have a 1 ml syringe with a 27 gauge needle. I'm going to administer medication via the 6 rights, and the 6 rights are the right dose, the right time, the right route, the right person, right medication, and right documentation. I'm going to check the doctor's orders and the MAR, and I'm going to get my medication. I'm going to check my medication for any cracks, particulates, and the expiration date. If it's a multi-use vial, I'm going to make sure it's properly labeled with the time, date, and the initials. And I'm going to mix the medication by rolling it in between my 2 hands. Okay. I'm going to untap it. I'm going to clean it with a alcohol swab. I am going to pull air into my needle equal to the amount of medication that I'm withdrawing. I'm going to do 0.3 milliliters of medication, and I'm going to inject the air into my medication vial. I'm going to put the syringe in at a slight angle to prevent coring. Okay. I'm going to put that upright, and I'm going to withdraw my medication. I'm going to tap the needle to get rid of any air bubbles. There we go. Okay. I'm going to recap the needle using the one-handed method. And I'm going to check the medication again to make sure that I have the right dose. Okay. Now we're going to go into the patient's room. I'm going to identify the patient using 2 identifiers, the name and the birth date, and I'm going to check again for any allergies and making sure that I'm following those 6 rights of medication administration. I'm going to explain the procedure and the medication to the patient, and I'm going to identify the correct site for administering the medication and then position the patient. I'm going to wash my hands, and I'm going to put on gloves. After identifying the site and positioning my patient, I'm going to clean the site with an alcohol swab, starting from the center and working out. And I'm going to let that dry. I am going to hold the needle with my dominant hand, and with my non-dominant hand I'm going to pull the skin taut, and I'm going to enter the needle at a 5-degree angle into the skin, just past the bevel. Okay. I am not going to recap the needle. I'm going to put it directly into the sharps container. And I'm going to draw with a pen a 1-inch circle around the wheel. And I'm going to document in the MAR and the nurse's note the time, date, and location of the injection.